And our section of religious leaders is pushing for resource mobilization to strengthen the healthcare services offered across the country.
Speaking during the opening of the Faith in Action Medical Conference in Karen Nairobi, led by the Nairobi Catholic Archbishop, the Most Reverend Anyolo, the leaders raised concern, particularly on the rising cases of maternal deaths as well as deaths owing to the cervical cancer menace, and called for action to combat this.
Timothy Kipnusu, who was there, and reports that the leaders have vowed to push for the formulation of policies to expand the HPV vaccination, maternal health services, and early cervical cancer screening, especially in a move that they say will help reduce the mortalities.
A section of religious leaders as well as health practitioners from across Africa convened in Nairobi on Wednesday in an ambitious initiative aimed at accelerating the fight against maternal mortality and cervical cancer, two of the continent's most urgent and preventable health challenges.
What we have as resources, the voice, the reach, the hospitals, we put them out there for humanity.
Led by Archbishop of the Catholic Archdiocese of Nairobi, Most Reverend Anyolo, the leaders called on other religious leaders to join hands in ensuring Kenyans receive proper health services to combat what they termed as unnecessary deaths.
We were to fight three major things. Number one, ignorance. Number two, poverty. Number three, disease. Today we are talking about disease.
No man, no woman should die when there is no need for them to die. And we want to ensure that we put that into practice.
Speakers at the forum call on the government to put strategies in place to expand the HPV vaccination, maternal health services, and early cervical cancer screening, especially in communities where cultural and religious dynamics strongly influence health-seeking behavior.
We have also policy documents that have been done, including the cervical cancer elimination strategy by the WHO, which is focused on getting 90% of girls all vaccinated, 70% of all women screened, and 90% of all women found to have anything suspicious or advanced disease treated.
We are going to dioceses where we are going to not only engage medical practitioners, but also pastoral agents like pastors and other faith leaders.
Kenya reports 342 maternal deaths per 100,000 live births, while cervical cancer remains the leading cause of cancer-related deaths among Kenyan women, claiming over 3,500 lives annually.
So today we are ambassadors of promoting these days so that as many women as possible can benefit from the camp that has been set.
So let's get our women informed. Let's get men to support the cause of action. Let's get faith leaders to utilize their opportunities in the pulpit, in their places of worship, to talk about these services.
Timothy Kipnusu for Prime Edition.